The clinical trial that I'm on my way to see is focusing on a condition that has played a significant role in my own life. It's hard to imagine, if you've never suffered from eczema, just how debilitating the itching, redness and soreness can be. I suffered from severe eczema as a child and right into my early adulthood, and at times it made me really miserable. And then miraculously one day it all disappeared. But for thousands of people suffering from eczema, things don't turn out so well.
I have eczema since I was 2 years of age. It started on my knees and on my elbows. The main problem or main symptom I have is itching of skin and also redness and dryness of my skin. Sometimes it will bleed because of wounds I get from the itching, so that's painful sometimes.
Anouk is a student in Rotterdam and, like many eczema sufferers, has found that one of the only ways to manage the symptoms is with powerful steroid creams, which ideally should only be used in short bursts. But now Anouk is taking part in a trial of an alternative treatment at the Erasmus Medical Centre in Rotterdam. We still don't fully understand what causes eczema in the first place, but it can be triggered by many different things. This trial is focusing on the role played by the different bacteria that naturally live on our skin. The researchers are taking skin swabs from each patient and sending them off for analysis. Dr. Bjorn Herpers is a clinical microbiologist and a medical advisor to the company who've developed the treatment I've come to see.
Yeah.
He's working with the team analysing the bacteria.
These samples were taken from the skin from a healthy patient, and here you see a lot of different bacteria growing. So there's a lot of diversity of bacteria on the skin in this culture. The next plate is a skin sample swab taken from a patient from the trial, and here you see a completely different story. Wow. You don't see the diversity anymore, but you see this one green colony overgrowing all the rest of it. And this is Staphylococcus aureus. And in some patients who have an eczema flare, up to 80 or 90% of all bacteria has become Staph aureus. And this is called dysbiosis, an imbalance of the bacterial skin flora.
Why does that matter if you have one more than others on your skin?
It matters for two things. First of all, a lot of bacteria that normally inhabit the skin are actually protective and needed for healthy and good skin. And the problem with Staphylococcus aureus is that it can produce substances, toxins, and with these types of toxins, Staphylococcus aureus produces or ignites the inflammation, like the redness and the itch seen in eczema.
Researchers have shown that in eczema, one particular bacterium tends to dominate, Staphylococcus aureus. Now they want to know whether reducing the amount of it on the skin could alleviate the symptoms. The challenge is how to get rid of Staph aureus without destroying the healthy bacteria too. And that's exactly the problem the new treatment they're trialling is designed to solve.
In nature, viruses kill bacteria, and they do this by latching onto them, reproducing inside them, and then bursting out through their cell wall. Now, the thing that allows them to break out in this way is an enzyme, and it's called an endolysin, and it's this that the treatment is based on.
Each natural endolysin kills a specific strain of bacteria, leaving all the others unharmed. So the researchers have harnessed those that only target Staph aureus. These test tubes contain Staphylococcus aureus bacteria, which makes the liquid appear cloudy. But when the endolysin is introduced, the results are astonishing. In little more than an hour, the bacteria are destroyed. Now this endolysin has been turned into a cream and is being tested in the eczema trial.
This independent clinical trial has recruited 100 patients. 50 of them get the cream with the endolysin inside and 50 get the placebo. And because this is a randomised double-blind trial, neither the doctors nor the patients know who's getting what treatment.
Alongside their treatment, each participant is also using a steroid cream, which is weighed at each appointment so the researchers know how much has been used. I asked two of the researchers, Dr. Joan Totte and Professor Suzanne Pasmans, what they were hoping to see.
We hope to reduce the level of steroids and restore the balance of the microbial composition a bit. What we want to investigate also if it really reduces the steroid load. And then complementary, we want to see if that reduction of the steroid load also leads to reduction in symptoms and reduction in steroid use. So it won't be a cure, but an additional therapy.
What are the measures of improvement in your patients?
The severity of the eczema has decreased. And the patient probably also has discovered then that he has less inflammation in the skin.
How soon do you think it's going to be before you'll know some of the results?
The first data will be there after a year. So probably a few months later we have really the results analysed.
This research is the first clinical trial of this treatment and will show whether it's effective. But because this cream doesn't contain any substance that's classified as a drug, it's less tightly regulated and is already available outside of the trial. One person using it is Miriam. Her son Renzo has had eczema since he was very young.
Miriam, tell me what it was like when you first discovered that your son had eczema.
Well, his skin was very dry and red and he had a terrible itch. He had eczema all over his body and also his skin got infected and it was terrible.
Tell me about what changed that.
When I used the endolysin, he slept the whole night through and his skin also was calm. It wasn't red anymore. It was a difference between day and night. He's happy. So when he's happy, I'm happy. Yeah, it's totally different.
The endolysin treatment has made a big difference in Renzo's case. But as well as alleviating eczema, there are other reasons to get excited about this new treatment. Researchers have found that bacteria cannot develop resistance to endolysins, and this offers amazing advantages for the treatment of a range of infections.
And with endolysins, because they do not induce resistance, you can have a continuous suppression therapy. So I see before me that with burn wounds, with diabetic wounds, you can have a continuous treatment. And I think that a lot of problems we now see in the hospital with infected wounds can be prevented by using endolysins in a very early colonization stage, before this colonization leads to infection. And I think this is a real paradigm shift we will see in the coming next years.
On this trip, I've seen a lot to get excited about.
I can't wait to discover the results of this trial, and if it's positive, who knows how many conditions we might be using endolysins for in the future.